Did you know that in January 2010, Wake County was ranked as the healthiest county in North Carolina in a study done by the University of Wisconsin Population Health Institute? But being the healthiest doesn't mean you can't get healthier. The 2010 Wake County Community Assessment revealed that Wake County, like many other counties, has some work to do in the area of obesity. In 2011, the Wake County Human Services and Environmental Services Board's Public Health Committee adopted obesity as its major health priority. And feedback from the 2010 Wake County Community Assessment, which ranked obesity as the #1 most important health issue, further validated the need to concentrate on this problem. Lack of exercise was ranked number 5 among the most important risky behaviors observed to be a major concern. Obesity rates continue to rise in Wake County. According to the latest stats from the NC State Center for Health Statistics, more than 25% of children ages 5 to 11 and 61% of Wake County adults were either overweight or obese. But the county is taking measures to tackle this health problem. More than 100 Wake County leaders representing business, government, nonprofit, education, health, community and faith-based organizations came together in March at the Wake Med Andrews Center to share in a countywide endeavor to talk about obesity. The event, Wake County Health and Wellness Summit, Winning the Obesity Battle, was an action-oriented meeting that highlighted the work that is currently being done to battle obesity and provided a forum for resource providers to find ways to collaborate. Elizabeth Spender-Smith, a health educator with Wake County's Health Promotion Chronic Disease Prevention Team, attended the summit. Elizabeth coordinates the Weizmann Program for Wake County.
The definition of obesity is the excess of body fat, which can ultimately lead to chronic conditions such as diabetes, heart disease, sleep apnea, and certain cancers. And to define obesity is you would have to use a BMI scale, which is a body mass index. A normal BMI is 18.4 to 24.9, when obesity starts at 30. Now, obesity is a serious epidemic now between adults and youth, and it has now become a public health concern. The Weizmann Program is a program designed for women who are uninsured, who are low income, and between the ages of 40 and 64. And within this program, we offer the ladies education, skills, and resources on how they can better improve their physical activity, their nutrition, and ultimately other healthy lifestyle behaviors so they can decrease their risk of chronic diseases. Eligibility for the Weizmann Program includes the ladies have to go through the Wake County Human Services Breast and Cervical Cancer Control Program first. And once they go through that program and are seen, they can then go through my program, which is a sister program to the BSEP program. 250% of the federal poverty guidelines to be eligible. Services that we provide through the Weizmann Program are blood pressure measurements, a full lipid panel to include the total cholesterol, LDL, HDL, and triglycerides. We offer a glucose screening as well as an A1C for the ladies who have diabetes. And through that, we also provide them with risk assessment counseling. If their lab values are abnormal, we refer them out to a medical provider for medical attention. And we also work with the ladies on goal setting so they can improve their healthy lifestyle behaviors through their own actions. The other programs in Wake County that battle obesity include all of the parks and recreation agencies. They offer a wide range of physical activity programs for all ages. Wake Med offers the Energize program for children who are at risk for type 2 diabetes. The Health Promotion Chronic Disease Prevention section offers a variety of programs that are age-specific to youth leaders. One example is the Healthy Me program, and that targets children 4 to 8. And another program is the InShape program, and we target children elementary through high school. And these are modules that we provide to youth leaders where they can incorporate these activities into their everyday programming. To get more information about the Weizmann Program, you can contact me, Elizabeth Spender-Smith, at 250-3990, or you can contact Denise Hicks for the Breast and Cervical Cancer Control Program, which will help get you eligible for the Weizmann services. Her number is 212-9310.
During the summit, following a panel discussion, attendees participated in small group breakout sessions to discuss potential obesity prevention and intervention strategies. Strategies were developed and discussed in 4 categories, where residents live, work, learn, and play. And I'm here where residents live to actually speak to citizens who've accessed Wake County services to help them better achieve their wellness goals. Sheila Dobbins is a Wake County citizen and Weizmann Program client. Sheila speaks highly of the wellness program.
Hi, I'm Sheila Dobbins. I'm a citizen of Wake County, and I am a part of the Weizmann Program of Wake County Human Services. I heard about the Weizmann Program through an appointment that I had with the Wake County Human Services, and they asked me to enroll. They told me a little about the program, and I was excited about it, and I did enroll that day. Taking charge of my health was very important to me because on both sides of my family, I have a history of high blood pressure, heart attacks, and different things like that. And I just thought it was very important for me to start now. You're never too old, you're never too young. For the Weizmann Program of Wake County, I had bad eating habits. My visit to Wake County Human Services was very helpful and very informative. There was a lot of things that I found out about myself. I found that I had high blood pressure. The program encouraged me even the more to take charge and to find out the different things and the more information about the disease. Since I've enrolled in the Weizmann Program of Wake County, I now have a better eating habit. I prepare my foods in a more healthier way for baking instead of a lot of frying. I do more water intake, more fruits and vegetables, and I also exercise 30 minutes a day. I would like to thank Elizabeth and the Weizmann Program of Wake County Human Services. I will charge all of you to try to call Wake County Human Services and ask for more information about the Weizmann Program.